All right, we're going to talk about albuterol here for just a minute here. I want to kind of tell you how it works and then a couple additional uses for it. So with albuterol, it is a selective beta-2 agonist. As most of us know, the primary response and the response we're looking for, whenever it is inhaled or nebulized, it will cause relaxation of the bronchioles. The bronchi and bronchioles are very muscular there in the lungs, and it will cause that relaxation, help open everything up. Hopefully you get more air in and relieve the symptoms that we're looking for. A secondary response for that, it does cause increased heart rate, and it may cause slight peripheral vessel dilation. So we might get a slight decrease in blood pressure, although the increase in heart rate will probably counteract that. And so, but just so you know, it might cause a little dilation there in the peripheral vessels. One thing it does not do is does not expand the alveoli. So we want to keep in mind whenever we're working with disease processes that are in the alveoli, like fluid overload with CHF, where they're filling up the alveoli, or pneumonia, where it's an infection in the alveoli, or atelectasis, that's another one, good one, where the alveoli collapse, they might not be helped very much by giving albuterol. I will say I would not withhold it, but it may not help, it may not have the desired effects, because albuterol works in the bronchioles, not in the alveoli. An alternative to albuterol is levalbuterol, and it is a beta-2 agonist as well. It is just a more refined beta-2 agonist, and so it doesn't have the side effects like increased heart rate that albuterol has, and so it is a little bit better drug. The reason you don't see it very often in EMS, though, is it's very expensive compared to albuterol, where you something like 10 times as much per dose. It's a lot more cost prohibitive for us in EMS. That's why we don't see it as much. But it is a little bit better drug, doesn't have the side effects. So one other use for albuterol that there is treatment of hyperkalemia. So whenever you put somebody on a nebulized albuterol, it will increase the uptake of potassium back into the cells, kind of the same way that insulin does. Whenever someone is hyperkalemic and they go into a ER, the standard treatment is give insulin and glucose, give them calcium, and all that stuff is designed to help reduce the potassium levels in the blood. And so one thing we can do in EMS is go ahead and start them on a breathing treatment of albuterol, and it will help lower down that hyperkalemic state. Of course, always check your local protocols. Don't go outside of your protocols without medical direction, but just so you know, it can be used for that, and it does work well for it to help out with the hyperkalemic state.